joins the rest of the world on December 3rd to observe the International Day of Persons with Disabilities under the theme Transformative Solutions for Inclusive Development. The role of innovation in fueling an accessible and equitable world. This day is intended to promote the rights and well-being of persons with disabilities and raise awareness of the situation of persons with disabilities in all aspects of social, economic, political, and cultural life. For those of you who are wondering what is disability, according to the Center for Disease Control, disability is any condition of the body or mind impairment that makes it more difficult for the person with the condition to do certain activities and interact with the world around them. In other words, it's a condition that makes things harder for them. Some disabilities make it harder for people to walk, while some disabilities make it harder for people to talk or learn. There are many types of disabilities, such as those that affect a person's vision, movement, thinking, remembering, learning, communicating, hearing, mental health, and social relationships. According to the World Health Organization, over 1 billion people worldwide have a disability, which accounts for 15% of the world's population. This number is expected to increase due to an increase in the prevalence of non-communicable diseases and population aging. Almost everyone will experience temporary or permanent disability at some point in their life. Some disabilities may be hidden or not easy to see. A person's environment, whether it's at home or work, has a huge impact on the experience and extent of a person's disability. Inaccessible environments, for example, can create barriers that can hinder a person's full or effective participation in society on an equal basis with others. The Ministry of Health is working assiduously to break these barriers, and today we will hear about some of the great achievements made thus far in rehabilitation disability services.
So in the ministry we have several programs. One, we have been expanding access to rehabilitation services by training more people and ensuring that our centers across the country are now equipped and have the right skill levels. So in all the regions now we have rehab centers. Secondly, we have also expended a lot of resources to acquire assistive devices. These include hearing aids, spectacles, walking cane, wheelchairs, and so forth. Things that would help people with physical disability being able to have a better quality of life. In terms of hearing aids, the ministry previously were charging people about $65,000 for a hearing aid because we were buying these things and giving them at the cost that we bought it for. But as of this year, we have removed the cost for those hearing aids. So now people can access them free of cost. And already we have distributed 500 hearing aids to people who need them. We have also started a new program to distribute spectacles. And we have catered for 4,500 spectacles to be distributed free of cost this year. We have already distributed about 597 spectacles. And with both hearing and the sight programs that we have professionals who would ensure that the persons are properly tested. And if they require, then they're issued either the spectacles or a hearing aid. So I think a lot of people have been very grateful for these programs because we are targeting a lot of the hinterland community where these services never existed before. In terms of other types of interventions that we have. So for young children, we are able to diagnose many young children with club feet. But this condition can be corrected with a non-surgical intervention. If the staff is properly trained, you can use plaster of Paris to make the correction. So we have started training this year in how to correct the non-surgical correction of club feet. And a lot of physicians from different parts of the country have undergone that training. So when they diagnose children with these conditions, they can treat them in the regions itself. We have also have an existing program with the Georgetown Hospital, for example. So persons who need replacement of joints, we are able to do those replacements. So our local doctors have been doing some of this, but the rate at which they can do it is very limited. They're not doing many of these joint replacements, but we have developed some strategic partnership. So for example, with Operation Walk Maryland, who were here recently, they have been able to implant 55 joints for persons who need them. So this includes knee and hip joints. And this type of collaboration would continue. We already are working with other partners to come in next year to work with us to help with joint replacement. So this is another program that we have to assist people who would have otherwise been immobilized and in some cases confined to wheelchairs. But by giving them this type of surgery, they can actually walk again. We have also been working with persons who have a need for prosthetic limbs. So if you had an amputation, we are working with those persons to get prosthetic limbs for them. So whether it's an arm or a leg, we have been working with a number of persons to do that. And next year, we are hoping that we can reduce the backlog for prosthetic devices that people would need. In addition to all of this, we recognize that with our child psychiatry program that we're able now to make more diagnoses of persons with autism. And once you make these diagnoses, you have to provide care for people. And at the Tolmareed Center, we have now expanded a classroom space to allow for autistic children. So these types of programs, we're going to continue them in the new year, and hopefully we can expand them to meet the demand that we have.
Apart from those great achievements, we were able to speak to some people who suffer from some form of disability but are currently employed by the Ministry of Health.
I'm a differently able person. My condition is called congenital deformity of the lower limbs. I was born with my disability, and due to rehabilitation, I was able to overcome to a certain limit and to go out there in society and be meaningful. I use my crutches for short distance, but I also use a wheelchair to do my chores at home, wash, cook, and so forth. And I use public transportation to come to work every day. I'm the receptionist here. I'm working with the Ministry of Health through the Rehabilitation Center. I do a little bit of typing too. I'm encouraging persons with disability not to give up. There is hope, and there is a lot of things out there that you can ask around and, get help. And so you're not alone. There are persons that have a disability and they can qualify just as much as a normal person.
I became a paraplegic just about 30 years ago. I was 20. With the intervention of physiotherapists and occupational therapists, I was able to to live a normal life as can be with being in the confines of a wheelchair. And the data entry clerk here, I enter data into the computers and then I analyze that data and submit reports to National AIDS Program Secretariat. If you become disabled, you have to first acknowledge that you still have life. And once there is life, there is hope. So with that being the foundation, I suggest you take it day by day. Depending on the disability, there are different therapies that will get you to a situation where you could maybe become independent physically, and you take it from there. But what you need to know is that you must have some support system. You cannot do this on your own. If you don't have family, you must have friends. There must be somebody there to support you somehow or the other. It doesn't have to be financial, but you need somebody behind you just to give you that support and encourage you to achieve what you want to achieve. Because although you may have a disability, you must have had goals in your head as to what you want to achieve. And not because you have a disability, you cannot achieve those goals anymore. So we have to find ways, or you have to find ways of achieving those goals. If those goals are not achievable because of a disability, there must be something else there must be an alternative that you must work towards so as to get to that stage in your life where you could actually be somewhat independent, because you're never totally independent whether you have a disability or not. People, I guess, come away with the sense that persons with disabilities are looking for handouts. But that's so not true. If you give us the opportunity to perform, to earn, I'm quite sure the majority of us will grab it with both hands and try to get to the same place that these normal persons are achieving and trying to achieve.
When persons with disabilities are included in everyday activities, they can and do contribute to society. Here's another example of such contribution.
My name is Dr. Fasana Henry. I'm a person with a disability. I have proximal femoral focal deficiency, which is a disease that causes one of my femur, which is the right in my case, to be missing. So I have one leg shorter than the other. So I use a prosthetic leg to adjust with my gait, which will enable me to walk. I was born with my disability. I am also a medical doctor. I'm also a holder of a Master in Public Health degree. I work as the medical superintendent of the New Amsterdam Regional Hospital in Region 6. Being a part of the healthcare workforce and being a person with a disability, I feel really great that I can contribute to society. Personally, I believe in inclusion for persons with disability into society, because persons with disability has a lot to offer. I feel really good as a person with a disability that was able to have that inclusion from an early age. I grew up in a society or in a community where inclusion was preached and it was also practiced. So I was never excluded from any activities, even if it may be challenging. I'm a type of person where if you tell me I can't do something, I do it. I may not do it as the normal person would. I may do it to the comfort of me or how I can, but I do it. And I believe that once persons with disability have that mindset, and I know persons with disability that does have that mindset, you can overcome any hurdle that is thrown your way. And as a person with a disability, in my capacity, I try my best to encourage persons, to motivate persons, to get persons involved in organizations where persons with disability can be educated, can be able to work, and can give back to society.
We are all different, diverse, and unique individuals, and we need to treat everyone with respect, love, and appreciation. Similarly, we need to work together to break those barriers that prevent disabled persons from participating in day-to-day activities as others would.
In Ghana, we're moving to a place where we want to recognize persons with disabilities and remember that persons with disabilities are still able and can still have equal access to the same facilities as someone deemed normal. We would like for buildings to be accessible, for buildings to have ramps. That's something that we will definitely start looking at next year to see how many buildings in Guyana has ramps so persons with wheelchairs can access these buildings. Also transportation. Transportation is another big area where persons with disabilities don't have access. So these are areas we can look at in the future to help to improve access for our persons with disabilities. Access to jobs would be important because we need to provide employment or provide areas where persons with disabilities can gain gainful employment. Agriculture is a good one where we can teach them to be sustainable farming so that they can grow and sustain themselves. Block making, we've done that at our National Vocational School recently. Barbering, hairdressing, things that they can do, trade things that can help them to earn their living. We need to remember equity, equality, accessibility as we look to improve the lives of persons with disability in Guyana. And there has been a lot of changes happening. We're trying to make hearing aids more accessible, glasses more accessible, wheelchairs more accessible to help our persons with disabilities to move forward.
If you or anyone you know is suffering from some form of disability, please contact the Rehabilitation and Disability Services Department of the Ministry of Health on telephone number 223-7087. We are here to offer our services to all.